All right, we're going to move on to the next organism that's closely related to Campylobacter. In fact, these two organisms were in the same genus for a while. Helicobacter is also curved and spiral shaped, similar to Campylobacter. However, it does not grow at 42 degrees. Okay. Now, the specific organism we're going to talk about is Helicobacter pylori. And most of you have heard of H. pylori. We talked about it when we talked about the normal flora, because we mentioned not only do normal flora organisms not grow in the stomach, there's only one organism we know of that can actually grow and replicate in the stomach, and that's H. pylori. What are some of the distinguishing features for H. pylori? The most important thing you have to know is that it has the enzyme urease. All right? And here's why. If it didn't have a urease, it could not grow and replicate in the stomach. The urease enzyme that H. pylori has helps create a type of ammonia cloud, okay, that helps to neutralize the acidity in the stomach and allows H. pylori to grow and flourish. So the most important virulence factor for H. pylori is going to be the urease. There are other organisms that are urease positive, all right? This little factoid is similar to what I told you about acid-fast, all right? Knowing which organisms are acid-fast helps you narrow down a lot of the information you have to know. It's the same with urease. There aren't very many organisms that possess a urease. So if you're reading a question and they say something, 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 urease positive, you've done the same thing. You've just narrowed down this huge volume of information, okay? So urease is really, really important. The reservoir for H. pylori are humans. So we basically get it from other humans by way of oral transmission or fecal-oral transmission, and it tends to spread very easily throughout households, all right? Now, the pathogenesis, again, you definitely want to focus on the urease, okay? You're going to get some inflammation when it invades into the lining of the stomach, and there are actually what are called vacuolating cytotoxins, okay? And those can also be considered a virulence factor, but they're definitely not as high order or high yield as the urease enzyme. Now, the disease associated with H. pylori, of course, most of you already know we're talking about duodenal ulcers. And H. pylori is really the causative agent of duodenal ulcers and chronic gastritis. One of the things I want to point out, though, is that H. pylori is actually associated with the development of gastric adenocarcinoma or stomach cancer, okay? And there are actually two different types of cancers that are associated with H. pylori. You have the gastric adenocarcinoma, and you actually have something that is referred to as either a maltoma or a B-cell lymphoma. And the main difference is that the B-cell lymphoma and the maltoma will actually resolve with treatment of the H. pylori. So this really is just in the mucosa, your B cells going crazy trying to eradicate the H. pylori, and your numbers get so high, you basically develop a B-cell lymphoma that again resolves during treatment. Now, the gastric adenocarcinoma does not resolve during treatment, and because it is associated with gastric adenocarcinoma, the World Health Organization has classified H. pylori as a type 1 carcinogen. Okay? We're going to talk particularly in the virology section about agents that are associated with cancer. All right? Whenever we talk about an infectious agent that is linked to causing cancer, that bumps it up a little bit on the totem pole, makes it a little bit more clinically relevant, high-yield information. So you definitely want to be aware that H. pylori is linked to those two types of cancers. Okay? Now, how are you going to diagnose it? Well, the way that you still are going to diagnose H. pylori what we call the gold standard is still biopsy with culture. All right? So we got a lot of people now that are on these Nexium, Prilosec. They'll get routine endoscopies. And while the physician is down there with the scope, we usually take a little clip and they'll just run the routine labs on that to make sure everything's clear for H. pylori. That is probably the best way to do it. It gives you a definitive diagnosis. You can also do a urease breath test, okay? But remember, the gold standard is still the biopsy with culture. Now, as far as the treatment goes, the treatment for H. pylori is a little bit difficult. Number one, because it's a multiple drug regimen, like we discussed for tuberculosis, like we discussed for leprosy. And it's also prolonged, okay? I'm just giving you one example of a combination therapy that is used for treatment of H. pylori, keeping in mind that there are many other combinations similar to this that are utilized. So the example I'm giving you is omeprazole, amoxicillin, and clarithromycin. So that's one example of the multi-drug regimen that now has to go on for at least 2 weeks and sometimes 3 weeks. They'll prolong the therapy a little bit. Okay, so that's the treatment for H. pylori.